Okay, we'll go ahead and get started. Good morning, and thank you for coming out this morning. This is our first of 2 sessions. We'll have one right after this, and this one's actually being recorded, so it'll be sent out to employees. This is going to be focused more on the healthcare side. Next Monday, we have one that is going to be on all the other benefits, so dental, vision, FSA, pet insurance. We've just added a new offering, legal plans. And so those will be briefed in that session, and we'll have different sort of refreshments available then. So just to quickly go over what I'm going to review today is the open enrollment process, some changes with CalPERS plans, and then how to select a health plan, and then Q&A. Open enrollment technically started yesterday. I know the email that has all the links has not gone out. It should go out by the end of today. We are just fine tuning it to make it a little bit better than last year's in terms of readability for the employees. But this is your once a year opportunity to change your plan, add or enroll dependents, either enroll or re-enroll in flexible spending accounts or dependent health dependent accounts. You must actively enroll to confirm or change your elections and to enroll in your FSA. That does not roll over, so each year you have to sign up for it and choose to elect to either be in it or not. These benefits are for January 1st through December 31st of 2025. Once you finish open enrollment, you can't change your benefits unless you have certain life events. Everybody must enroll to BCC. This is, I think, the 3rd year we're going to be doing that. Same system. It should be the same format where your username will be your last name and the last 4 digits of your social security number. Your initial password is the first 4 letters of your last name, the month and day of birth. So, for example, Mickey Mouse with the date of birth of 9/2/23 would be MOUS 0902. If you've had any difficulties with that, they did reset that this morning to make sure that this was the format for the initial login. Also, if you do have any issues, the forgot password will let you do your initial password if it's not working. I did that yesterday, but the username is correct, and then the company name is City of West Covina. Once you log in, you'll be asked to confirm your security information, which should be like 3 questions of like where you grew up, those types of things. And it'll prompt you to change your password so that no one knows what that is. Then you'll confirm your demographic information, any spouse or children that you have listed. And then you'll get into selecting your benefits, starting with medical, dental, and vision. The system does calculate and should show you what your monthly employee rate will be when you're going through and making those selections. And then you'll go through life insurance, and then LTD, and then voluntary plans, life, accident, critical illness, legal, which I mentioned is something new for next year, and then your flexible spending account and dependent care. You can add or change your beneficiaries, and then at the very end, there'll be a confirmation statement to confirm all of your things. So I definitely encourage you to print it out, review it, like print to PDF so you're not killing trees, but print it to PDF, review it, save that as well, and then hit the confirm button, because it's always good to have that handy for yourself in case there are any issues. One thing we're definitely encouraging you to do is you enroll through BenXL, but later on in the presentation, I'll be showing you several pages of the CalPERS site. We're not enrolling through CalPERS. CalPERS has an open enrollment. However, we do ours through our own software, and we upload to CalPERS system. So just make sure to always look at the BCC for your enrollment and not anything that you're getting from CalPERS in terms of like open enrollment. So I just want to make that clear, because you probably are getting some emails from CalPERS that says open enrollment's going on, click here to enroll. Please don't go through that process. Please go through the BenXL, because this will ensure that your payroll is done correctly, because this is what we're going to be bringing in through that. If you do have any life-changing events where you're going to be adding anybody, please make sure to submit those verification documents, which, like if you're getting married, adding somebody as marriage certificate or domestic partnership registration or birth certificate or social security number, those actual documents need to be submitted to HR by the 10th. So in addition to changing that online in BCC, you need to submit the documents as well. What's new or changing for 2025? So in 2025, CalPERS has expanded the HMO plans to new regions. Costa County, Shasta County, Imperial County, Monterey County, or Salona County. I'm not sure if that affects any employees, but I know that we have some that live far away, so maybe it does. There are also some changes to the PPO plans. Blue Shield of California is the new administrator for all PPO plans. Blue Shield is partnering with Included Health to provide member services, and Included Health will also expand access to care. There are no changes to copays, coinsurance, or deductibles for the transition to Blue Shield. And for all plans, there's a doula benefit for all pregnant and postpartum members on the basic plans. And there's also a travel benefit for medically necessary care. So those are some additions that globally CalPERS has rolled out with. Next, I'm going to go into what to think about when you're trying to choose your plan. Of course, cost is always something front of mind, coverage, and then availability. The cost of your plan will be included in the employee guide that goes out, both the ones who are hired before 2018 and after, as well as all public safety. But then when you're going through BCC, it'll give you the monthly rates as well in there. Then for coverage, I'm going to go over a little bit on how to maybe what documents to look at when comparing coverage to coverage, and then availability, because CalPERS actually has a really good tool that you can see to search for a doctor. If you're wondering, will this doctor be covered under another insurance? They actually have a site for you to check just that. So first off, just the difference between HMO and a PPO. The HMO doesn't have a deductible and doesn't accept out of care network. You have to have a referral to see a specialist, and you must select a primary care physician. However, the HMO has predictable cost, and it allows you to not have to manage your own care, and you won't receive bills from providers. However, it is less flexible, and as I said before, no out-of-network coverage, and you have to select a primary care. A PPO provider has a deductible and lets you go out of network. So you can go anywhere to see whatever doctor you want, and you can keep your doctor. You just may pay a little bit more to go out of network to do that. When comparing, it's good to look at the summary of benefits of coverage. This is the standard form that is all insurance carriers have to provide legally. So this is like a federal standard form. I always refer to them as the blue sheets. So each carrier has this form for the different plans that they provide. This one is just an example of them. And these are available on the CalPERS site. And a link to this will be available in the guide that you receive. Here we go. So pulling up the CalPERS site, it's under Forms and Publications. And I'm just going to pull up one. They're all listed. The 2025 plans are right on top, and you can search for whatever plan you're looking for or just go down the list. But just to show you what one looks like in full. So it goes over what's the overall deductible, maximum out of pocket, will you pay less when you use a network. So different events are covered here so that you can do an apples to apples comparison. So these same types of events are on every single form for every carrier, and they must list the answers so that you can do that apples to apples comparison. And at the very end is a 3 scenarios that each one have to provide for the exact same event. So whether you're having a baby, whether you're doing, whether you have type 2 diabetes or a fracture. And just to show you, for example, same exact fracture, plan A would cost you $100 and plan B would cost you $200. So utilizing that site is helpful to actually see, like, okay, if next year I'm going to have a procedure, what is it going to cost me versus this plan or not? And that's something as simple as you may have already decided, I'm going HMO. Okay, well, between the HMOs, there still may be a difference in some of those. So it's definitely helpful to look at those because that's what you're paying at the end of the day outside of your premium. As I mentioned, CalPERS has a place where you can search by zip code. What is it? What's the zip code? I always forget. 917? Okay. Basic plan. Yes. So within a 20-mile radius, I'm just going to pick a name that I think a doctor might have, and they all pop up. I did a very basic generic search. You can go in more detail, less radius, but this is a way you can check to see if it's your doctor is covered and who it's covered under. And then this is just a annual reminder to get your preventive care. So each of whatever insurance you do choose, it does have preventive services that are at no cost to you, even if you haven't met your yearly deductible. So the services can range by your age, sex, or medical history, but it's fully covered and when you get it in network. So definitely encourage you to go for your annual blood screenings or whatever other screenings may be applicable to you depending upon your age, sex, or medical history. Basically, go for your annual physical, please, since it is covered. And then that's all I have on the presentation. We do have United Healthcare and Blue California outside since it just switched from Blue Cross Blue Shield. So now they're going by Blue. And then Kaiser out there as well. They have some flyers. We also have some flyers from HealthNet as well. So they can ask and answer, they can answer individual carrier questions. I can answer questions on the process or things like that. And again, as I say at the beginning, next Monday, we'll have a presentation that's a little bit more longer because as we go into each of the different other benefit carriers, there's a little bit more to it, but that'll be dental, vision, our flexible spending account, pet insurance, MetLife, and legal plans. And that'll be the same format in terms of like 1 at 2 and 1 at 3. And we'll have different refreshments in the afternoon then. But the open enrollment email should be going out by the end of the day. I apologize it wasn't before, but we had some last minute changes that we wanted to make for it. But at this time, I'll take any questions. Yes. Yes, they've been reset each year because we didn't expect employees to remember it. But that's a good question. Any other questions? All right. Well, thank you for coming today. If you didn't get a donut, please do that, or a goodie bag on the way out. We encourage you to get one of those. And then, as I mentioned, United Healthcare, Blue Shield are here, and Kaiser.